Okay. Hi, everyone. My name is Elsabet Samuel, and I'm a member of the Rice University chapter of the American Lung Cancer Screening Initiative, or RALSI for short. And today I'll be giving you a quick presentation on lung cancer and lung cancer screening. And I'm so grateful for the opportunity to present to all of you today. So thank you for your time. So before I get started, I'd like to ask for you guys to please save your questions till the end. I'll be more than happy to take them afterwards. And we have our university website for our club down below, as well as the national website for the organization. And so before I get into the content of this presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. So ALCSI is a nonprofit that works to raise awareness for lung cancer and lung cancer screening. And we're a team of over 70 passionate students and doctors located across the US. And we've worked with community organizations such as the South Asian Network, as well as city and state health departments. And we hope that in educating communities about lung cancer and lung cancer screening, high-risk individuals will be encouraged to seek a lung cancer screening. And today we'll discuss both lung cancer and lung cancer screening and addressing questions such as how common lung cancer is and what lung cancer screening can do and how ones could get screened. So to start off, lung cancer is very common. It's actually the second most common cancer in the US, excluding skin cancer. This graph shows the American Cancer Society estimates for the number of new cancer cases in 2022 in the United States for the four most common cancers. And as you can see, it's estimated that 200,036, 740 people will be diagnosed with lung cancer in 2022 in the US. And to put this number into perspective, it's estimated that about 6% of people will develop lung cancer during their lifetime in the US. So that means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. And moreover, not only is lung cancer very common, it's also very fatal. Lung cancer is the leading cause of cancer-related deaths in the US and in the world. And in 2022, it's estimated that lung cancer will claim the lives of 130,180 people. And this graph shows the American Cancer Society estimates for the number of cancer-related deaths in the US alone. And as you can see, lung cancer is far more fatal than both breast, prostate, and colon cancer combined. It makes up almost 25% of all cancer deaths, resulting in about 350 deaths every day. And each year, there are about 50,000 more new cases of breast cancer, but there are over 90,000 more cases in lung cancer. And if we look at lung cancer incidences and mortality by sex and race, we can see that among males, lung cancer incidence is highest in Black males and at an incidence rate of 71.7 per 100,000 people. And among females, lung cancer incidence is highest in white females at an incidence rate of 51.1. Mortality rates mirror the incidence rates. So Black males have the highest mortality rates among males, while white females have the highest mortality rates amongst females. And from this data, the question that arises is, why is lung cancer mortality so high? Well, to begin, lung cancer mortality is so high because patients are typically diagnosed at a very late stage. So this graph, the graph that we're looking at here at this page, basically shows the proportion of patients with lung cancer by stage. And stage is just a way for doctors to classify a cancerous tumor based on the size of the tumor and if the cancer has spread to the lymph nodes or other parts of the patient's body. And currently, most lung cancers are diagnosed at a distant stage. And when the cancer has spread beyond the site in where it had originally started. And this graph is based off of data from 2008 to 2017, published by the National Cancer Institute. And as we can see, about 21% of patients are diagnosed at a localized stage, while about 51% of lung cancers are diagnosed at a distant stage, which is when the cancer is spread to various parts of the body. So why is this important? It's important because the stage that lung cancer is diagnosed correlates directly with survival. And we'll kind of see that on the next slide. And one way the doctors track the survival of patients is by looking at the 5-year survival. And as you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses. This graph is just another way to understand the relationship between the stage at diagnosis and the 5-year survival. So the 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, nearly half of the lung cancers are diagnosed at a distant stage. And this is why early detection of lung cancer is extremely, extremely important. If we detect lung cancer at an early stage, then treatment options as well as the prognosis will be much better. And with lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. And the answer is that majority of the patients are diagnosed with late stage lung cancer because they don't start feeling any symptoms of that cancer until the cancer has grown and spread to different parts of their body. So the most common symptoms that most of us know are maybe chronic cough, coughing up blood, chest pain, loss of appetite, fatigue, and a new onset of wheezing. But however, when people become symptomatic, the cancer has grown and spread to a point where it's more difficult to treat, and which makes the prognosis very poor. But if the diagnosis of lung cancer has to wait until the patient has symptoms, it's difficult to catch lung cancer early. And so now the question that we have is, how do we catch lung cancer early if the patients are asymptomatic? And the best way to do that is through lung cancer screening. Lung cancer screening is done using something called low-dose computed tomography scan. If you're eligible for lung cancer screening, it's recommended that you get an annual lung cancer scan. And in the coming slides, we'll discuss what lung cancer screening is, who should get screened, and how to get screened. So an important distinction I want to make is that lung cancer is done using low-dose computed tomography, also known as low-dose CT, and not the chest X-ray. We use low-dose CT scans because it provides more detailed pictures than chest X-ray, and it's better at finding those small abnormal areas in the lungs. And the picture on the left that you guys can see is of a chest X-ray, and the yellow arrows point to the abnormal area in the lung, but it's unclear. And on the other hand, the image on the right is a picture of a low-dose CT scan of the chest, and the red arrow points to the abnormal area in the lungs. And here the picture is a little bit more detailed and than the chest X-ray, and it allows us to see the abnormal area with greater detail. And the question that researchers wanted to answer is, how effective is low-dose CT scans at detecting lung cancer at an early stage? And an important lung cancer screening trial called the National Lung Screening Trial, or NLST for short, tried to answer this question. So the NLST was a large national study with over 50,000 patients. And the goal of the study was to determine the effectiveness of using low-dose CT scans to detect lung cancer in patients considered at high risk for lung cancer. And so the study included 2 groups, and one group was a group of patients who received the annual low-dose CT scans, and the other group was a group of patients who received an annual chest X-ray. And by comparing the stages at which cancers were caught between these 2 groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. And as stated on our slide here, the participants who received screening with LDCT, low-dose computed tomography scans, had a 20% lower risk of dying from lung cancer than the participants who received the chest X-ray, which makes a huge difference. And as we can see here, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the X-ray diagnosed more patients at stage 4. And this has an important implication for survival. And because the low-dose CT scan has caught more lung cancers at an early stage, these cancers were more likely to be treatable, and the prognosis was much better. And this translates to a 20% reduction in the mortality for those who underwent the lung cancer screening using low-dose CT scans compared to the chest X-rays. So now we ask, who should get screened for lung cancer? Well, the United States Preventative Service Task Force, also known as the USPSTF for short, set guidelines for who should be screened for lung cancer. And right now, they recommend that people between the ages of 50 to 80 and who have a 20-pack-year smoking history or greater, and who are current or former smokers or who quit within the past 15 years should get an annual low-dose CT scan. And so the current screening guidelines requires you to have a 20-pack-year smoking history. And now a pack year is probably a term that most of you have not heard of before, but it's just a way for doctors to track your smoking history over a period of time. A pack year is defined as smoking a pack of cigarettes per day for a year. So for instance, if you were to smoke one pack a day for 20 years, that would equate to a 20 pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack year smoking history. So the important takeaway is just that there are many different ways to reach that 20-pack year smoking history. Smoking is the primary risk factor for lung cancer, as many of us know. And when compared with people who have never smoked cigarettes, a current smoker has 25 times greater risk of getting lung cancer, and about 8 out of 10, 81% deaths from lung cancer in 2022 are expected to be caused from smoking cigarettes. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. And moreover, secondhand smoke causes almost 3% of new diagnoses of lung cancer and is expected to cause 3% of deaths from in 2022. And additionally, other risk factors include family history of lung cancer, previous radiation therapy to the lungs, COPD, and many more. And it's important that we recognize that these additional risk factors, because although the lung cancer has a strong association with smoking, there are a number of individuals, both in the US who've never smoked, that are still getting lung cancer. So never smokers are defined as individuals who smoked less than 100 cigarettes in their lifetime. And because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to sometimes even 20% of lung cancer diagnosis. And it's actually the 8th leading cause of cancer-related deaths in the US alone. In the US and in the world. More never smokers die from lung cancer each year than people die from ovarian cancer. And this graph shows us the proportion of lung cancer cases that occur in people who've smoked in their life and people who've never smoked. It's even further broken down by whether they're current, former, or never smokers. And as you can see, 80 to 90% of lung cancer occurs in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. And interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of the never smokers diagnosed with lung cancer are females. So right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding that lung cancer in never smokers is a current focus of research is extremely important. And with the development of new screening technologies and risk models, there may be a way to identify the high-risk never smokers who should be getting screened for lung cancer. So in summary, lung cancer is a leading cause of cancer-related deaths in the US. It's so deadly because most lung cancers are diagnosed at a very late stage when they've spread to other locations in the body. And importantly, early detection through lung cancer screening by the use of low-dose CT scans can reduce lung cancer mortality by up to 33%. So currently only 5.7% of high-risk individuals are currently getting screened for lung cancer. And to highlight how low this number really is, we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. As you guys can see on this slide, the American Lung Cancer Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save 48,000 lives. However, we're only screening 5.7%, which means that a lot of lives that could be saved are not being saved. So why is that? Well, the lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. And in the next slides, we'll discuss each of these topics. And the important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. So the first potential concern I want to address is the cost of lung cancer screening. So the average low-dose CT scan costs anywhere from $300 to sometimes $400, but most insurance companies, including Medicare and Medicaid, will cover this cost for the eligible patients. So, however, there are some few exceptions. Medicare will only cover lung cancer screening until the age of 77. And not all states' Medicaid plans cover lung cancer screening. And lastly, patients will still have to pay the usual fees for provider appointments before or after the scan. So as I just mentioned, unfortunately, not all the states' Medicaid plans cover lung cancer screening. Here is a map that was updated in September of 2021, showing which state Medicaid plans do and do not cover lung cancer screening. Blue states have state Medicaid plans that cover lung cancer screening, and the purple states have Medicaid plans that do not cover lung cancer screening. In the pink states, we don't have that particular information at the moment. And the first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions that a primary care provider has to ask the patient. And one of these is the patient's pack year smoking history, which we talked about a little before. And so to find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or the city they live in to see where accredited lung cancer screening facilities are located near them. And the American College of Radiology website is listed on the bottom left hand side of the screen. And this map is a map for Houston specifically. I know you guys are in Garland. But so as far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes, super quick, and you'll be doing something very similar to the patient in the photo. And one thing to note is that this process will not hurt at all whatsoever. This means that there will not be any needles or injections involved. The low-dose CT scan is non-invasive, it's fast, and it's completely pain-free. And additionally, the amount of radiation exposure is very low. A low-dose CT scan exposes you to less radiation than you're exposed to from just existing on Earth, which means that the level of radiation you receive from the annual lung cancer screening test is very minimal. And that being said, this is always something that patients can discuss with their primary care provider. And so a question we often get at ALCSI is how vaping and e-cigarettes use affects lung cancer risks. And so vaping and e-cigarettes are relatively new phenomena and have been more relevant in the last decade. And while the lung cancer effects of vaping are still being studied, it's clear that for individuals who have never smoked before, it increases the risk of lung cancer. And e-cigarettes devices and vaping fluids contain nicotine derivatives and heavy metals, and among various other chemicals. And so these arise both as elements of the e-liquid and as a result of organic reaction in the electronic cigarette device. And various studies demonstrate in vitro transferring of these derivatives. And vaping causes fewer health risks than smoking, but it's not a risk-free activity. Vaping can increase heart rates, decrease air volume in the lungs, and increase airway resistance. And furthermore, e-cigarette devices, the use of e-cigarette device has been significantly increasing, and particularly among young adults and non-smokers, making it an area of concern for the future. And as this presentation comes to a conclusion, I want to end on what the American Lung Cancer Screening Initiative has been doing to help the widespread awareness. So we've been educating and advocating for efforts that are necessary to increase the lung cancer screening rates. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are getting screened. And we're working to address all aspects of this issue. We wrote and advocated for the House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. And actually last December, our Senate resolution was passed by consent. I'm sorry. And additionally, we're working to teach communities across the country about lung cancer and lung cancer screening. And lung cancer is the deadliest cancer in the world, as we discussed, but by working together and we can overcome and save millions of lives. And it starts by working together to raise awareness and initiate lung cancer screening program in our own communities. And I, as well as the whole team, believe that by educating the communities, especially our students, about lung cancer and lung cancer screening, it's a crucial way to lowering the number of deaths associated with this disease. So students greatly impact and influence the healthcare of their parents. And we hope that by educating students about important measures that can be taken, we will not only be able to help the students, but also their family members. That's all I have for you guys today. I'm sorry I tried to kind of rush the presentation. I hope if you guys have any questions, please feel free to ask me. And you can also always visit the website for more information or reach us through social media. But thank you so much, you guys, for listening. I really appreciate everyone's time. I wish I could hear you guys. But yeah, if you have any questions, please feel free to reach out. Okay, how do I?